Okay, so as you recall, when we started this unit last week, the main idea of studying this particular unit, which is health and social care sector, was to understand the broad range of careers and options available when we look at working as a healthcare worker, as a healthcare assistant, and a healthcare professional working within the NHS or any of the related organizations to do work within this sector. This is to look at things like working in care homes, old age homes, working with children, working with adults, vulnerable people. And the idea there is to try and provide, with regards to, broader understanding in terms of how this particular sector works and what is the role the healthcare professionals play in terms of while working within the, ecosystem. Now, the first learning outcome focused on understanding the overall structure of the Health and Social Care Department in the UK. And we looked at organogram, Department of Health. Underneath that, we looked at the NHS Constitution, the NHS Act, the local authorities. We looked at PCC trusts, PCCT trusts, and the commissioning groups. And then under that, we looked at surgeries, community, care centers, pharmacies, and, the paraphernalia of hospitals and A&Es, which basically provide service in terms of, health and social care service, mental health care service, any sort of service which is required by the members of public within the care sector or within, from a point of view of medical care is provided by this sector. We understood the role of watchdogs, especially organizations like CQC, Care Quality Commission, the National Institute of Care and Healthcare Excellence. We looked at some of the charity and, social enterprises like the King's Fund and some of the other regulators, which primarily, when we look at the NHS Act and the Constitution, what role they play in terms of, making sure that these bodies which maintain and define quality standards within the sector ensure that, these standards are being followed by doing inspections and obviously having grading scales in order to ensure that members of the public get due care. The care is provided using the six principles of person-centered care. We are also looking at, the care being provided in an environment wherein the person receiving the care is able to make independent decisions, dignity, privacy, respect, and things in terms of discrimination because of culture, background, race, religion is not done. Then we also looked at the roles and responsibilities of all the healthcare professionals. What are the various roles? And there are lots of roles within this sector, and people work within these roles as an occupational therapist, as a nurse, as a healthcare professional, as a let's say in administration, on operation, and four different various categories and functions that we looked at, which constitute about 23 different types of roles. So the idea there was to discuss a particular organization. We took up an example of a care home, and then within the care home, we looked at the roles of a practice manager, a healthcare professional, a visiting GP or a doctor, doing locum, nurse, a clinical nurse, a healthcare assistant, and depending on this organization that you choose, you would be looking at discussing roles, because here it talks about discussing roles in a named organization from a point of view of health and social care. And then the two merit criteria are basically looking at the importance of continuous professional development. So in this sector, what we do get to see is a lot of people are required to upskill, reskill. Employers are responsible and tasked with making sure that the staff is provided adequate training before they actually start working, and they are aware of the basic nature of the work which is required to essentially provide care. And then the evaluation of the structure was to do with, again, talking about a named organization, which could be a care home, and basically shied away from talking and taking an example of the NHS, because here, if you take NHS as a named organization, it's quite a big organization, and obviously you'll struggle to draw up a structure for that organization. So there, the idea was to try and take a simple organization which you're aware of, which you have worked in or volunteered in, or are you, could do a bit of a Google search to find a care home or a setup, which basically you can get information from the website and then use that information on the website to be able to draw up a structure of the named organization. Now, in the second learning outcome, we went into understanding what are minimum legislations which are, required essentially, to, make sure that let's say the service standards, the processes, and the quality of care being delivered to the patient is actually, done. So in this case, is everyone able to hear me? Are you able to hear me okay?
Yes.
Okay, that's great. Solar, you might need to log out and log back in because your mic isn't functional. It's not showing us that your microphone is on. So you just log out and log back in again, and this time log in with audio. So in the second learning outcome, we looked at essentially understanding the 15 standards, which are a part and parcel of the UK care certification standards, which have been set by the NHS and the CQC, and how these standards are then used in delivery of care to patients or members of the public when they're receiving care within the NHS. And then we understood what is the relationship between person-centered values and these care standards in the merit criteria in learning outcome 2. Now, in learning outcome 3 today, this is a bit of a recap that we've done, but in learning outcome 3 today, what we are looking at is essentially understanding the importance of multidisciplinary working within this sector. Now, as we all understand that when we look at health and social care, it's a very big, department. Now, there are lots of private players which primarily end up, essentially also providing services to the members of public. Sometimes these could be, as you have seen, that we have, say, for example, excessively long waiting lists. Sometimes certain facilities, when they are not available in a particular trust or hospital for that service to be provided, then in those cases, NHS or the healthcare department, basically the NHS essentially refers the patient to a private provider or a provider which works in partnership with the National Health Service to be able to deliver, that particular service to the professional. So it could be that there is a long waiting list for operations which are supposed to happen. And if you're waiting for a heart transplant or a stenting to be done, just as an example, in some cases, what the NHS would do is then refer you to Spiral or Bupa or, an external organization which works in partnerships with the National Health Service. And that is where the patient would go in and get an operation done or the clinical procedure done. This is obviously reimbursed and subsidized by the NHS, because obviously in the UK, as you know, most members of the members of the public receive medical services free. So we'll be looking at understanding what are the ways in which partnership working first works within this sector. Then we'll be looking at understanding what are the benefits and challenges, and at a later stage we'll look at why the healthcare sector needs to work together. When I say work together in terms of private and public partnership, and then we look at taking one or two examples of describing and discussing, public-private partnership within this sector. The merit and the distinction criteria primarily focus on, understanding the working of a role in promoting multidisciplinary work. So sometimes you would see people from outside, the sector, for example. Sometimes you would see that when we look at multidisciplinary working, NHS would basically invite consultants, or sometimes when people have to be invited from outside to be able to contribute to the place of work in terms of maybe a surgical operation or some sort of a procedure, then in those cases you would see that this particular part involves working with people from not just within the national service, but from outside the national service in terms of international organizations as well. And then what we look at is also understanding distinction criteria. What are the consequences if this multidisciplinary working or the approach of partnership does not if it does not happen within this sector, then what could be the disadvantages specifically is what we'll be looking at covering in the distinction criteria. Now, as always, let's look at going through some of the key bits of the content using the PowerPoint slide, which I put together, and these slides would throw a bit of light on what we need to be able to discuss in Learning Outcome 3. Learning Outcome 3 is all about, just to re-emphasize and focus on the importance of multidisciplinary working. So when we talk about multidisciplinary working, what do you mean by multidisciplinary working? What is multidiscipline? First, if I have to look at just a basic definition of, multidisciplinary working, what is the basic definition of multidisciplinary? So when we talk about multidisciplinary, we are talking about, combining or essentially looking at involving several different academic disciplines. Multidisciplinary, that means several different, multi means many, disciplinary is a word which originates from the word discipline. So many disciplines, that means we are looking at combining and bringing together several or many disciplines, which could be academic disciplines, medical disciplines, nursing, so when we talk about disciplines, we're talking about medicine, nursing, midwifery, looking at other types of disciplines like gynecology, cardiology, things like that. They are going to be brought together, and people specifically working within these disciplines will be coming together with their professional specializations in a way together to be able to offer a service or help look at solving a problem or an issue, or giving some sort of, let's say, a resolution to a patient who's having, say, for example, a particular diagnosis. So here the importance of multidisciplinary working means we are looking at combining and involving several academic disciplines, people coming from different areas to be able to approach and then look at solving a particular problem, or giving or providing care to a particular patient who has had a surgery or is undergoing a surgery, or things like that. That would be the essence of when we talk about what is called multidisciplinary working. Now, if I talk about multidisciplinary teams, so here what we are going to be referring to is a range of healthcare professionals, people coming from different backgrounds, organizations, and their professional experiences will contribute towards working together in a single team or as one team to be able to then provide or deliver comprehensive patient care. And that would be the essence of, I would say, multidisciplinary team working. So when we look at this particular learning outcome, I think I want to be very clear that we should understand what do you mean by multidiscipline, and what is a multidisciplinary team, and what is the importance of that team working within the health and social care. So multidisciplinary essentially would mean that people coming from different academic disciplines, and then we are looking at people with different backgrounds, different experiences, specializations, and from different areas, which could be things like, people who are psychiatrists, nurses, mental health care nurses, you're looking at social workers, occupational therapists, all these people coming together as and becoming a part of one team to be able to deliver patient care would be an example of what is called a multidisciplinary team. So this is very important for us to understand, because this learning outcome is all about how these people, all from different backgrounds, different walks of life, different professional and academic interests, come together to be able to then work together to be able to give or provide patient care. That is something which is very important. Now, one of the other things which I want to mention is that when we talk about partnership working, what do we mean by partnership working is that when we talk about partnership working is when these people all are coming together to be able to work together and then provide some sort of care essentially to patients. Now this care could be somebody who's receiving care for dementia, could be somebody who's receiving care for say any sort of treatment which they are getting, and they would be, required, primarily to work together to make sure that this care, is basically delivered. So when we talk about partnership working within the health and social care sector actually started, way back, in the early 60s. And this was primarily a way which was proposed that sometimes when we look at, working within and providing services within the health and social care sector, um, you know, people would need to work in essentially partnerships. That means private-public partnerships. And when we talk about, partnership working within healthcare, what we mean by that is that people will need to come from separate organizations, and these separate organizations will need to sometimes pool their expertise, resources, and they will then be looking at providing services, to the people. Now, an example of partnership in this case would be when you look at, and I'll give you a simple example, that when you look at, say, for example, when, say, for example, a lady is looking at giving birth to a child, you see a team of triage which comes together from different, they work in different positions within the National Health Service, and they come together and they take care and provide a lot of different types of services so that the lady who is looking at delivering a baby, does that successfully and then recovers from any say, for example, effects post the delivery as well. So in this case, you would look at nurses, midwives, you look at essentially, healthcare workers, healthcare assistants, therapists. They will all come together. And obviously when actual delivery is being done in the hospital, you will see doctors and clinical nurses also, and even consultants coming across. If it's a C-section which is required, then the team comes together as a multidisciplinary team. They all work in different departments. Nurses are looking at doing different things. Healthcare assistants are looking at different things. The triage team basically looks at doing home visits. They look at separately. When you look at occupational therapists, they are looking at providing, therapy, or say, for example, sometimes you go to these classes just as if you're becoming a new parent, your partner and your spouse go together and attend lots of these different types of classes, which will help you understand how parenting is to be done. So these are therapy classes which are being organized, and the whole system comes together in delivering this particular care, which is required primarily to so these have to come together primarily to understand how this care is to be delivered, how this care has to be tailored in such a way that it meets the requirements of that particular individual. So partnership working is very important. And when we say partnership, it does not, mean the partnership. There is working relationship which happens, and which needs to work primarily between nurses, midwives, healthcare workers, doctors, clinicians, to ensure that the delivery, which is, say, for example, the delivering a baby, goes as per planned. Now, when we talk about the background of partnership, and when we talk about the current welfare system and how this was introduced, it was introduced in the 1940s. Just a bit of a background, and this is primarily done and adopted into the NHS when the Labour government came in 1997, and they reintroduced reforms in the National Health Service. So the National Health Service was increased, the spending in terms of the National Health Service was increased, and patient care was added to the NHS, constitution. And in order to provide, full care to the patients, the rolling of this particular concept of partnerships, essentially started and being adopted within this particular sector. Now, when we talk about, partnership, what we are also looking at is the partnerships are looking at improving the outcomes. So, for example, the wait times. When we look at A&E services nowadays, the prescribed wait times from CQC are about 2 hours, but wait times for A&E, in certain areas up in London, areas like London, is up to about 7 hours as well. So when we look at working in partnerships, the government and the healthcare department and the people working on the front lines are actually working together with patients and their colleagues and different set of teams to be able to look at improving, improving, when I say, is basically looking at reducing these times, which are waiting times required from a handover of the patient to be happening from the ambulance A&E services to the hospital before they can go and start attending, other, queries. So when we look at improving the outcomes, taking small steps which are achievable to be able to reduce these time frames, and this is being done by using the combined knowledge, expertise, and skills of different people coming together to be able to offer this service. This will all constitute, partnership working. Now, when we talk about, the National Health Service, and it was formed and, created in the 1950s after the World War II, and the government has taken a lot of initiatives, but over the years, this particular institution has also undergone a lot of change. Now, there are lots of different white papers which are, published essentially, on improving, or let's say, improving the services and the quality of service which, essentially the National Health Service provide. Now, white papers are also published because they are looking at doing a bit of research, collecting data, and then we are looking at reforming, some of the practices and obviously, the processes and procedures which are followed within the National Health Service. Now, when we look at a lot of white papers which are published, these are published as proposals. They are built up on recommendations, and the recommendations are basically looking at proposing improvements in how the National Health Service delivers, let's say, the care services to the members of public. Now, these white papers could also be looking at reforms. These reforms could also be looking at, essentially meaning that there will be changes in regulation which are introduced. And sometimes when you look at these changes in regulations, they are introduced because of the, experiences the NHS has had in the past. And in order to correct those, plans of action, these reforms are introduced, and some of them are then also introduced in terms of a legislation and an act. Now, if you look at the COVID pandemic, what you will generally see is with the COVID pandemic, this is a once in a lifetime, situation which the National Health Service has faced. And before this, the pandemic, if we look at comparing the COVID-19 pandemic, the bubonic plague of 1700s or the 1800s, I think, I don't remember the, exact timing, but it happened. What I'm trying to say is that when these kind of things happen, they typically happen once in a century. So when we look at the last pandemic, which the human race has faced, that was about 100 years back when we looked at the bubonic plague. And there are lots of changes which it needs to be implemented in the NHS, in the National Health Service, in order for us to be able to cope with such kind of pandemics which could happen in the future. So when we talk about working in partnership, when we talk about looking at how, the policies and processes are shaping up over the years, they are being done by the introduction of reforms or proposals. Let's say they start with proposals on the white paper, which are built upon recommendations and research work, which is gathered from the National Health Service. And then they are, then these proposals, which are built upon recommendations, are then, built further to be able to introduce reforms within the National Health Service to ensure that the National Health Service is able to adapt and then provide the services or care required to the members of public in let's say, the changing times. And when we look at these kind of changes which are introduced over the years by the introduction of white papers and reports, one such report, if you recall, which I mentioned to you, was the Lord Darzy's report, which we studied, essentially in, the person-centered approach unit. And that report, when we looked at Lord Darzy's report, that report was primarily research conducted into the workings of the NHS. And then later on, that report essentially, became the foundation of the NHS Constitution and the NHS Act of 2010. And this included the main part of the report, the main points of the report were essentially, the integration of person-centered care into, the services which the NHS provides, and the high quality care which is required to be provided specifically so that people are able to make independent decisions, their dignity, respect, privacy is respected, and all those things were made a part and parcel of the, were a part and parcel of the NHS, Lord Darzai's report. Now, when we look at modernization, which is an important point for the NHS, sometimes when we look at health improvements which have to be introduced in the National Health Service and modernization plans have to be introduced, you would look at how the COVID-19 pandemic has allowed the National Health Service to adapt and, provide then the first, or let's say the largest vaccination program which the National Health Service has ever carried out in a span of about, 6 to 9 months and across all ages. Now, this kind of working has happened in partnership with, private players as well. So communities, schools, you look at clubs, colleges, you look at pharmacies, you look at hospitals, you look at, various public infrastructure places, all have been utilized to look at this mass vaccination program in order to protect the members of the public from the COVID, virus. So in this case, what we see is the partnership in working as a process where, the government has to sometimes invoke the closer working with private players and some of the other parties which work very closely with the National Health Service and are a part and parcel of delivering some of these services to the members of public. Now, when we talk about, outcomes, what are the outcomes which partnerships should deliver? Because we are focused on understanding, in terms of multidisciplinary teams and working in partnerships, what we also need to understand is that what is the objective of this partnership at the National Health Service level. Now, this partnership could be looking at delivering, care for children, childcare. It could be delivering care for children in the early years, as we say in the primary years. It could be looking at delivering care in terms of better outcomes for health and social care sector in general, when people are using community healthcare centers or care homes and, those kind of setups. It could be care which the NHS is delivering for people who are recovering within hospital or from a particular condition that they have received treatment for. So partnership can be looked at, this concept of partnership, basically people coming from various disciplines, backgrounds, experiences, then coming together to be able to deliver care is the whole concept of partnership. Now, partnership can span across different, parts within the National Health Service as well. So as I mentioned, children, it could be early years, it could be childcare, vulnerable adults, it could be, people in, getting care towards end of life, people recovering from clinical, procedures or operations which they've had. All this would be looking at, people working from different walks of life, working within the National Health Service or within the health and social care sector, coming together to then deliver this coordinated care, to the patient who's essentially recovering, say from an operation or a procedure they have had. Now, when we look at this concept of partnership across the health and social care sector, this has seen a lot of change over the years. And from its adaptation in the early 1997, and in order to avoid fragmentation, the government has also looked at introducing new frameworks. One of the frameworks which has been introduced is the new outcomes framework for performance assessment of adult social care. And this was introduced in 2006. Now, the reason of introducing, this particular framework of adult social care, as we call it, was done primarily to ensure that, yes, when we say people are working within partnerships to be able to deliver this care to the patients, but the requirement of the framework was intended to help support and embed performance management standards, within this sector. So sometimes it's easy for us to introduce goals and objectives that this has to be done or that has to be done. But how do we ensure that these goals and objectives which have been introduced are then measured, or there is a performance, related output which is derived from them? So the government introduced this performance and quality framework, which was based around the adult social care in 2006. And this was primarily done to deal with challenges, but at the same time provide opportunities which are linked to the main objective of, providing integrated care to the members of public under the pretext of partnership was introduced. And this particular report and the framework which was introduced is looking at driving improvements and enabling and supporting all staff which work within the adult social care side of things under this sector, and how they would look at bringing across a difference. When I say bringing across a difference, that would mean how do they face up to the challenges? How do they look at understanding the opportunities in the context of providing care to the patients? And last but not the least, looking at understanding that how care can be timely provided in a way which meets the 6C stand, the person-centered approach principles and the care standards which are prescribed by the Care Quality Commission. Now, when we talk about this particular report, for those of you who are interested in reading about this particular report in detail, I would be providing this particular handout, which is the performance and quality care, framework, which is, something which has been adapted by, various hospitals and trusts in England and Wales from the main framework which was introduced in 2006. And what happens is, obviously, these standards in this framework are revised over the years in order to ensure that they are current and are meeting the requirements of the patient. So this particular handout, which is about 12 pages, covers and explains the adaptation of the performance assessment framework, which was introduced in 2006, primarily, for driving partnerships and ensuring that, the new approaches, the new working approaches which are created, they are including the elements of job satisfaction, autonomy, and also making sure that the patients are able to receive care, which is intended care that they are receiving in order to help them get back on their feet, or, to basically get better. So this is an example of that framework, which shows how, acts, legislations, government governance, and obviously user voice, which is basically the patients, are all included in the framework in order to ensure that the working in partnership is able to provide the services required by the patient in order to get better. So this is a report which I would or a framework extract that I would primarily upload along with the presentation, which will be for additional reading. And this framework allows performance assessment standards to be built into adult social care, which is the main point, that although working in partnership has been introduced and billions, millions and billions of pounds have been invested in ensuring that these services are delivered to the members of public, but who is the body, or how is the accountability done, that the partnership and the steps which have been done or have been taken are essentially making it work. So this particular framework then looks at providing this evaluation of the performance management cycle to ensure that partnerships are essentially working within the national health sector. Now, going back to the presentation, wherein we want to understand, how some of these services, essentially when we talk about working in partnership, how they can be, looked at in terms of ensuring that the customer, when I say customers here, patients would be receiving, the adequate care which they're required to get in order to, get back to their feet, or for the procedure that they are, receiving this care for. So let's take an example of a positive outcome as a result of partnership working. So when I look at an example of how different teams come together and, work in order to ensure that care is being provided. So let's take an example that, we've had somebody, in the house who requires, let's say, effective support to be able to do daily activities. So we are talking about an elderly person, and this elderly person, requires some sort of a support from a social care worker in order for her to do her daily activities. Now, when the social care worker reaches, the home of this elderly person, she sees that there are lots of different, areas in which let's say, the property in which the person is living, or the house in which the person is living, is needing repairs, and obviously it's not safe, for the person itself. So what the social care worker finds is, when she comes to the house to be able to, provide this particular care, she sees that the person is not able to go up the stairs, for example. There is lots of dirt, garbage, and the house is not clean. And what she also looks at is that there are basic bits in terms where the house is not very well lit, or some of the facilities within the house need a thorough clean. Now, what she then does is, as her role as a social care worker, she's not required to do, say, for example, any cleaning of the house, or, for example, making sure that, stairs work and, they are not broken and things like that. Now, what she does is, when she comes in, she does an assessment in terms of if the care had to be provided, and if I have to look at doing my bit of work and look at the elderly person who's basically living in the house on her own. She then does a bit of an assessment and involves a few agencies or people in terms of ensuring that the person does not get any harm because of what she has seen in the house. So first of all, she'll speak to a manager. She will say that, okay, I've gone into the house as a social worker, and my aim was to basically help her bathe and, do some daily chores. But I noticed a couple of things. One, the house is not clean. Second, the stairs, the person is not able to go up the stairs. The third, there are parts of the house which is not very well lit, and these could lead to slip, trip, or falls, which could mean that the elderly person could badly bruise or get hurt. And what she does is she sensitizes the manager, her manager, to ensure that she has provided this risk assessment information to him or her, to say that these are the things which could be leading to a bit of a endangering, which could lead to maybe possible injuries to the elderly person if they are not looked into. Now, in turn, the manager would basically then speak to the local council, and the council would then send people across who would primarily go and see if the house is fit for purpose, and if there is basic cleaning and other things to be done. So what we are seeing in this case is that, as a healthcare worker, you are speaking to your manager, who then speaks to a wider setup of the local authority, and the local authority would then involve different people who would go in and, for example, pick up the garbage, get some cleaning done, or cleaners, or other workers who would go in and obviously see if the house is fit for living, and will assess whether the person would be okay to live on her own within that setting. Now, what this has done is, this has basically shown us an example that how the healthcare worker will be speaking to a number of people through the manager, and they would then try and ensure that proper things are put in place to be able to ensure that the person staying at home, if they continue to stay, there might be some counseling which will be offered, that it'll be better off that you move to a care home. There could be risk assessment done by a health and safety expert to see if the house is fit for purpose. Now, this involves a lot of different types of people working together from different walks of life and backgrounds to ensure that the elderly person living in the house, is actually safe. Now, this is an example of partnership, working in partnership, because you have the local council involved, you have the health and social care professional involved, you have the health and safety professional involved, you have the authorities involved, who would then be providing adequate information, and basis the facts which are collected from risk assessment and the observation which the social care worker has done, would then be leading to a decision with the elderly person to say whether she would want to continue staying in the house or would she want, to move to a care home. And this would be looking at providing, let's say, working of, lots of different people coming together to be able to work in partnership, and then helping the elderly person adapt to a safe living environment wherein that person would feel safe and would be having or receiving proper care, and would be an example of partnership working. Now, any questions on this so far? Any questions that have come to your mind? Right. If I go further, just generically covering the learning outcome first. So we want to understand what is multidisciplinary working, what is multidisciplinary team, what are the frameworks which have been put together in terms of, the performance framework which has been put together, the legislation, then looking at an example of how partnership, working, how working in partnership actually works by taking an example of an elderly person and a social care worker, which I've just done. And now let's look at understanding benefits of partnership working. Now, lots of benefits or lots of barriers to partnership working, are possible. So let's look at the barriers first. So when we talk about barriers, these barriers could be when we have lots of people involved, they come from different backgrounds, different experiences. They could be creating barriers as far as, working together are concerned, because sometimes you have people not recognizing other people working in different roles. They feel their role is more important than somebody else's role. And these could be team dynamic barriers, which we generally get to see when you put together people from different aspects of life with different experiences, different academic backgrounds, coming together to, work as a team. The second barrier that we look at is, working barriers in terms of fundamentally looking at building relationships, how the team is working together. Are they able to understand their roles and responsibilities? Are they able to work as a coordinated team? Do they have enough training? Do they have enough experience in terms of people being able to, have enough data and information to make, let's say, decisions? Are they going to be working effectively together as a team in terms to be able to make decisions which are right for the patient or for the members of public receiving care? Communication could be one of the barriers. So, for example, sometimes you would see people, they come together and they are, prepared to work, but they are not committed to sharing information, or, they are not committed to being open and transparent. Now, that could be a particular barrier. Sometimes you would see that people come in and they work, but they work, they work on a reactive approach. They don't work on a proactive approach, which is required to work within this sector. And in order for them to work, proactively, they would want a more open environment. That means people are able to share information. They do not, keep information to themselves. And in some cases, they also look at getting equal responsibilities or a say in terms of, how work is being delegated. And these could be some of the, barriers that we could see. We could also see barriers which could come because of respect and understanding of each other's role. There could be barriers which could be coming because of the fact that sometimes when people come from different walks of life, and when we look at multidisciplinary teams, that means people coming from different, backgrounds, different cultures, they could be termed as barriers. Sometimes you would see language could be a barrier. So poor attitudes could be one of the barriers, that, you are a part of a team, and you are committed to, before you're brought into that team, you're committed to essentially working and providing these services, but your attitude sometime and the behavior that you show can also become a barrier. And in general, in those cases, interactions, one-on-one discussions, relationship building, open communication channels tend to then do away with these barriers, and people become generally more confident and open and transparent while they work within the health and social care provision to be able to provide these services. So there are lots of different types of barriers that we can think of, which can come, and become walls, or, essentially create, let's say, confusion and chaos. because people are working, and people have been asked to come from different facets of their life experiences, academic qualifications, and then are being asked to deliver or take on roles to be able to deliver, the quality of care. And these barriers can be done away by looking at training, looking at holding training events, communication, being transparent, honest, looking at ensuring that information is shared across all levels, making sure that there is proper establishment of networks, and there are proper channels through which information can be disseminated to all members of the team which are working together. Best practices are shared, and obviously audits are done in order to ensure and pick out gap areas so that adequate training and development can be put in place for members in order to ensure that they are also able to play their part and are able to, be a part of, successfully be a part of a team which is delivering, care to the patient. Now, with this understanding in mind, let's go into quickly and discuss some of the assessment criteria which are associated with this learning outcome. So any questions on this so far, I'll be happy to take now before we get into the assessment criteria. Okay, if you think of any questions, you can ask me through the chat route as well, but let's quickly go into some of the assessment criteria. And the assessment criteria here we are looking at is the first one being 3.1. And this assessment criteria is primarily looking at talking through benefits and challenges of working within partnership. Now here, as I looked at, when I talked about barriers could be challenges which people are, essentially facing when we talk about, working in partnership. So if we are to discuss what could be the benefits first of working in partnership, it could be that why are people, but let's look at generically without thinking about the health and social care sector. Let's look at for a minute parking health and social care sector to one side and just talk about partnership working in general. Now, when do you think people are brought together as a team or brought into a team to be able to, work together for the company or for an organization? We generally see that when the company is looking at, or an organization is looking at achieving or accomplishing bigger objectives, bigger goals, or looking at raising their profile, the brand image, or essentially bettering or talking about their services that they provide to the members of public, that is where you will see the teams, people in teams come together and they are brought together to essentially, help achieve a bigger objective. There could also be areas wherein sometimes you would see that the benefits of partnership would come by looking at people being able to work well together. They are able to build relationships and networks which allow, streamlining of communication channels and essentially, information being delivered across to every person within that network or within that team. And that allows, transparency, confidence building, and dependency to be built up within the team. And that would be one of the benefits of, I would say, partnership. Now, sometimes you would look at partnerships also becoming important because of the fact that the company is looking at, maybe competing with challenges, which could be faced by the organization because of market conditions. So when we talk about partnerships, if you look at the COVID-19 pandemic, the government looked at working with all parties, scientists, looking at working with, members of the public, key groups, looking at the healthcare department, other departments like the finance ministry, in order to ensure that, there was a coordinated response from the government to deal with the pandemic, because the economy was hit. So obviously the finance department had to come in, the chancellor had to introduce emergency budget and measures like the furlough scheme. So there was working in a way to deal with the pandemic, because the government was looking at the holistic picture in terms of, okay, if we start looking at, dealing with the pandemic from a health and social care department point of view, but at some stage this will have a knock-on effect on the economy, the vaccination program. There were lots of different departments which were coming up, and that required people to come together, to work together, and they are some of the benefits, because it helps in division of responsibility, ownership, and also at the same time helps you put together a coordinated response to a bigger problem. Now, what could be the challenges, if I talk generically, that you would have in partnership, working in partnership? Challenges could be, there are different leadership styles. For example, people, when they come from different walks of life, different experiences, different backgrounds, different education qualifications, they would be having their difference in terms of attitude, behavior, management styles. It could be their values and beliefs. Essentially, they would be, all these would be challenges. There could be challenges on the financial side. There could be challenges which the team faces because of the legislation and the government policies. There could be challenges which is because sometimes you would see people come together in a team and they have their own agenda. So in order for them to lose their own agenda and their own, and understand what is the team's agenda, or the reason for why partnership working is being introduced, takes a bit of time. So all these could be challenges that you would generally get to see, essentially, within the organization. Now, when we talk about, the benefits and challenges that we have to look at within the healthcare sector, what we want to be able to do is talk about what are going to be the key areas where we look at this working and facing this particular as a topic as when I say, let me look at, say, for example, let me just so if I look at substituting the word challenge with, say, a competitive analysis, that means somebody, if they are looking at justifying, that how they were going to deal with or engage with, a particular problem which arises, then in those cases, you're looking at, working in partnerships. So when we talk about the arrangement of individuals and entities and different organizations agreeing to work together to achieve a common goal, that is where we will see partnership working. Now, when we see partnership working, and in order for that to be successful and effective, we will always have, benefits and challenges. Now, if we have to talk about this in the context of health and social care sector, some of the common benefits that we talk about in terms of what makes partnerships successful is continuity of care. That means the plans have to be drawn up in such a way that there is a process through which care becomes the central part of this particular working. And if high quality care has to be delivered, then we need to look at open communication. There needs to be coordination. There needs to be collaboration amongst the different people working within the team, and the integration of individuals, equipment, departments to be able to thoroughly deliver this care or holistic care to the patient who is receiving it would be essentially the importance of the benefits of working within partnership in the health and social care sector. Now, these partnerships can be of different types. They can be partnership between two public authorities. They can be partnership between public authorities and communities. It could be partnership between private sector and the public sector. There could be partnership at the local and the international level. So partnership has a very broad meaning. So here what we are looking at is understanding partnership, going back to our key theme of multidisciplinary teams. We're not talking about multi-professional approach, multi-sectoral approach. We are talking about multidisciplinary teams. So people working within this sector, health and social care sector, nurses, psychiatrists, therapists, doctors, clinicians, healthcare workers, we are talking about that. So here, when we talk about them and we talk about the advantages of or benefits of working as a team, that is what you will need to put into the benefits. And these benefits would be, the benefits would primarily include, things like ensuring there is, for example, open communication, there is coordination, and there is collaboration to be able to deliver holistic care to the patient. And they would be, also looking at utilization of resources available within the National Health Service, and these utilization of resources to be done in a way which are making it efficient and productive for the individual to receive the care and get well or get better soon would be the advantages of or benefits of working within the healthcare sector. Now, let's talk about some of the challenges. What could be the challenges which teams could face when we are talking about working within partnership in health and social care sector? Now, one of the things that we continuously hear, and I'm pretty sure that you'll be able to relate this to, is the NHS is cash strapped. The NHS needs investment. The NHS needs modernization. Now, these are very broadly the challenges which the government is faced with in order to improve the National Health Service. I think, I'm not too sure, but if you looked at the news a couple of days back, Steve Barclay, who's the health secretary, was actually, when he was giving an interview in public on camera, one of the passers-by actually said, "You've had 12 years to improve the A&E times. How long would you need?" And the person actually, vented their anger at Steve Barclay when he was giving the interview to one of the television channels. And this is, when we talk about challenges, what the National Health Service is facing or the health and social care sector is facing, these are the challenges that they are facing. Finances, availability of trained manpower, nurses essentially, because of Brexit. We're looking at challenges in terms of funding or finances because there is not enough finances available. Modernization challenges, equipment, and let's say replacing outdated equipment within the NHS. The waiting times which patients have to now look at in order to get in touch with their GPs at surgeries. These are challenges that we get to see, which are challenges which are being faced, by essentially by the health and social care sector. Now, using partnership, and that is where, if you see slowly and gradually, some part of the NHS, National Health Service was fully nationalized, but over the years, we see some part of the National Health Service also now works very closely with private companies and organizations to be able to deliver certain types of care to members of the public. And that has been done primarily to ensure that the constraints, that the backlog of cases, which, for example, the COVID pandemic has put in, people who were receiving treatment for cancer, for heart, related diseases and, conditions, they were put on a bit of a, there's a big queue now. So in order to ease this queue, partnership working with the private sector within the National Health Service is ensuring that these long waiting queues and queue times are being brought down. And these are some of the challenges that we have to talk about when we talk about the assessment criteria 3.1. Now, going across to assessment criteria 3.2, it talks about explain how health and social care sector and people within the sector actually work together. So here we have to talk about the characteristics of partnership. Now, why are partnerships established within this sector? They are established for a common cause. And the definition of partnership is very clear, that it talks about how, people work as a part of one team towards looking at achieving the objectives of the National Health Service or the organization in this case, and how communication is done effectively to ensure that all people working from different teams are involved and they are able to then basically provide the holistic care required for the patients. Now, when we talk about how the health and social care sector works together, here we need to be able to take an example of what could be the benefits of partnership, essentially, which are done in order to ensure that we are able to address specific issues, maybe in the short term or in the long term, and how sometimes service provisions or quality of service provisions are essentially met because of shortage of resources or a shortage of trained manpower. Now, we need to be able to talk about the benefits of partnership in this case. So here, when we talk about benefits of partnerships and different stakeholders which are involved in the National Health Service, we need to be able to look at that how partnership can help boost the overall morale and efforts in terms of motivation, when staff is adequate to be able to provide service. How do we look at a particular case example or a case study here, and then use that to explain what are the benefits and why multidisciplinary team or working as partnership works within the health and social care sector. So here, when I talk about different benefits of partnership and different models of partnership, we talk about different partnership models which work together within the NHS, and they include things like the networking model, the referral systems, the consortium model, the multi-agency working model. And these are all different models which are basically important in order to understand partnership working within the health and social care sector. Now, one example is multi-agency working model. Now, as you can see, a lot of people work as supply staff within the National Health Service. Now, when we talk about the multi-agency working model, is that if, for example, you call in sick or you're not able to make it today to your place of work, the NHS or the particular hospital or the department in say, for example, a surgery within an area has some tie-ins with a local agency, and that local agency is able to essentially provide workers at a very short notice to be able to come in and take the role of working because someone in the team has called in sick. Now here, when we talk about the multi-agency working model, what we are looking at is that one or two or more organizations actually come together to share resources and then deliver some of the care which is required on a particular day to the patients. Essentially, the idea is they're working jointly to be able to deliver care to the patients. Now, sometimes you'll see that you have GPs who work on locum within a surgery. If there are people who are, if the GP surgery is going through and has a lot of demand of seeing the patients, sometimes you would see staff is not well or they're off sick. Then in those cases, what will happen is that the one of the surgeries would request a consultant or a doctor from another surgery to come in and help out in terms of the working load, and that is where doctors would end up or GPs would end up doing locum. Now, this is an example of partnership model because this is very clearly planned in order to ensure that surgeries which are in a particular area, they're able to work together, they have a bit of relationship, and they're able to ensure that if in need, then some of these services in terms of GPs being made available or nurses being made available on locums can be done in order to ensure that patients do not suffer, and obviously these services can be seamlessly provided. And they would be an example of how you would explain how partnership works within this sector. So maybe taking an example of your local surgery, and sometimes if you need to see a GP urgently on the weekend and you would generally have a GP doing a locum, that would be an example of how partnership can be shown working within the sector. Now, the third assessment criteria talks about examples of best practices which we can actually describe or share in terms of how partnership benefits specifically the health and social care sector. So here, what I would suggest is that we would need to take out or basically do a study of a case study, and we will need to look at a practical example of how good practices can be integrated within good practices can be included within working in partnerships, and that would allow essentially integrated care to be given. Now, here is what I would suggest, that we would need to look at a website wherein I would share with you that this is a website wherein we will need to look at maybe picking out one best practice, and that one practice was essentially be from any of these listed case studies that you could pick out, and then talk about essentially discussing let's say the example of how community say healthcare can be delivered, or how multidisciplinary teams can essentially support people receiving care for mental health problems, and they could be related to describing one of the best practices, which is partnerships, working in partnerships within this particular sector. Now, I normally end up taking an example of the ambulance services. And if you look at this in particular, they would be quite helpful because it will give you a very clear example of how the ambulance services sometimes come under stress and pressure because of the increased demand, from patients within the area during certain times. So during winters, for example, you would see people suffering from, flu, and sometimes elderly people, or a lot of people, because of the COVID pandemic in the last 2 years, also compounded with problems of underlying health conditions, required more, the ambulance services came under pressure because there were more requirement for them in a particular area. And that is where, some of the ambulance services, A&E worked with St. John's ambulance services, or, other ambulance services in the area within the sector, to be able to then provide and meet these requirements, to serve the patients. And that could be in a way where you could talk about some of the practical examples of how, integrated care or best practices can be used to deliver integrated care. And I would suggest looking at reading, this particular website and picking out a particular article for the purposes of completing this particular, task. Now, taking you back to the slide. So we're looking at the merit criteria very briefly. And in the merit criteria, what we want to be able to do is understand the role of learning and development, especially when we talk about the, the role of what role does learning play when people are working within a multidisciplinary team. Now, learning and development is quite important, and this is something that we've seen in the previous learning outcome when we talked about the CPD, or career professional development, which has to be part and parcel of career pathways and options given to people working within this sector. Now, one of the reasons why learning and development is very important is because when we talk about delivering integrated care, in delivery of integrated care, we do see that people would need to understand their roles, responsibilities of working within the multidisciplinary team, which is going to be very, very important. So when we talk about people's roles and responsibilities and what their roles and responsibilities will entitle them to provide and work as, would be important, because this is something which the staff needs to understand by undergoing training and development. So when we talk about the role of learning and development, we are looking at people working together to ensure that care and support is coordinated and provided in a manner which is going to be beneficial for the patient. The different roles that we see and responsibilities that we see, say, for example, in a care home, have to be very carefully defined. And these roles and responsibilities then have to be taken up by, people who work within the care home, like as home care managers, workers, carers, healthcare professionals or practitioners. For example, nurses and even GPs, when they, are a part of care homes, they would need to understand what their role and responsibility is, and how they would be looking at effectively delivering their roles and responsibilities to ensure that integrated or holistic care is provided to the patient. So when we talk about the role of learning and development, the people working within a care home, as an example, would need to be, well trained. They will essentially need to be receiving training. In some cases, training can happen over a period of time through the process of mentoring, and they would need to be observing somebody as a colleague to learn some of the best practices in terms of how to deliver this, care. And that would essentially be a part and parcel of, things which are which people will pick up through the process of learning and development within the organization. Now, here is what I would suggest, that if we have to look at, I would say, taking an example of, the role of training and development, or learning and development, and how this works. Sometimes you would see that, I will give you an example that, okay, here, if I talk about, a patient receiving care, say Malcolm and Barbara, just as an example, and they are receiving this care, what you would generally see is they're receiving dementia care. So in this case, you can see the number of people who are involved in providing this care to the two individuals. Now, sometimes they would need care from, advice from, or they need to see the GP. Sometimes they will need to see the nurse. They would also need to see a social worker. If there is an emergency and they need to be picked up by the ambulance, there are lots of other different types of cares, things like wheelchair service, oxygen service, a physiotherapist. They might also need to go across to a dentist. Now, this is an example of people receiving care and what is required for them to be able to, cope through that particular process. Now, if you see a number of people who are involved in delivering this care to these two patients would need to have adequate training. And this adequate training would essentially ensure that these people are, able to provide care to the best of their abilities and requirements of the patient. So, as an example here, what I would suggest is when we talk about the role of training and development, essentially in the case of working in multidisciplinary team, you would need to take up an example of how this actually works in the case of people and teams. And that would be possible if you discuss something which is related, I would say, with a specific example. And that would be, something that you would be able to pick out. Now, in order to look at understanding this topic in a bit more detail, what I have also got is a handout or a case study, which I'm going to share with you. And this case study is going to be looking at how training is used to promote multidisciplinary working amongst nurses. And this particular case study, which is a 2-page case study, would shed some details on how training provides the basic fundamental building blocks of how nurses come together and provide care to patients at the hospital. So this is going to be a good read to understand and, complete and achieve the merit criteria. Now, taking you back to the slide to discuss the last part, which is primarily looking at the distinction criteria. So here we are looking at understanding the potential consequences of, partnership not working in the health and social care sector. So what happens now, we've so far understood in the learning outcome, the benefits and, some of the advantages of seeing partnership work within this sector. But what happens if the partnership does not work? What happens if there is no partnership? Then one of the things that we could see is there are negative outcomes which will come out in terms of, negative outcomes for the users. That means patients, essentially people working within this, setup in the National Health Service. You'll probably see the negative outcomes tend to be abuse, neglect. It could be anger. It could be miscommunication. And they could be essentially, if partnerships are not working well, there would be blame which will be put on, by different organizations and people working within the set up to say, okay, I'm not to blame, they are to blame. And, these kind of things would essentially come up in terms of neglect, anger, abuse, and they would essentially be, the negative outcomes of the partnership not working. Now, one of the other things that we could also see is that what could be the potential consequences if the partnership is not working. This could be because of trust and respect is lost. It could be because of shortage of finances. It could be because there are different goals and objectives which are, not being shared between people who are working within this team. It could be quality of work which will suffer, and as a result, the patients will not receive the care which they are intended to receive and get well soon. It could lead to wastage of resources, financial resources. Lack of proper communication could also be leading to, neglect, which would mean, again, patients would not receive the adequate amount of care which is required for them to get better soon. And they will all be the negative aspects of when partnerships do not work. So here you would need to focus on, talking about requirements which are going to be related to If training and development is not done, adequate education and qualifications are not there with the staff, then the quality of care being provided is going to suffer. Standards are not going to be met. Mishaps could happen. It could lead to deaths or increase in the number of cases. It could be lapses which could happen in the legislation, things like health and safety if people are not adequately trained. And then when we talk about if partnerships are not working, what you're going to see essentially is that when partnerships don't work, it leads to neglect, abuse, wastage of resources, and in some cases, it will also lead to what is called anger and miscommunication. So the example of what I mentioned earlier, that when Steve Barclay was giving an interview and somebody as a passerby, local member of the public passing by, obviously shouted at Steve Barclay, the health secretary, saying that you have had 12 years to improve the health and A&E services. Wait times and nothing had happened, and people are losing their life. People have lost in trust in the government. Is anger essentially, and those are the I would say the consequences of if partnerships do not work within the health and social care sector, and that is where the services fail. It leads to neglect, and it also leads to standards of quality not being met, and as a result leads to loss of life and other types of consequences which the members of public can face. So this would help us cover the distinction criteria. Now this brings us to the end of this particular unit, and hopefully we have covered this in a sufficient amount of detail. I will have some additional reading which I want you to also go through, which is the two main articles that I've shared. One is the training to promote multidisciplinary partnerships amongst nurses as a case study. And then one of the websites in which we talk about the role of multidisciplinary teams and the best practices that we need to talk about in terms of, delivering integrated care. And last but not the least, talking about, if partnerships do not work within this sector, then the framework which has been established by the government essentially to ensure that performance is measured, and how performance standards are measured within this particular setup. That particular handout is going to be useful to get a good understanding on this particular learning outcome. So if I just quickly share that with you again, so that for the benefits, when you look at the presentation, you're also looking at these three handouts for additional study. This was the first one which I talked about, performance and quality framework. Then we talked about the best practices that we need to look out, picking out any one of them to show how multidisciplinary teams allow the delivery of integrated care, and this is by taking up an example of best practice. And last but not the least, how learning and development is promoted amongst nurses to help in to help promote multidisciplinary working, which allows holistic care to be delivered to the patients. So I hope with the presentation and this particular three handouts that I'm asking you to look at, doing a bit of self-study, that will allow you to crystallize your understanding on what we've discussed with regards to the study of the learning outcome 3, which is importance of multidisciplinary working within the health and social care sector. Now, at this stage, I would like to take any questions. Any questions, at this stage? Any questions from today's session? Harrison, any question at your end?
No question.
Okay. Rose, any question at your end? Okay, Toby, any questions at your end?
No for now.
Okay, Christina, any questions at your end? Noreen, any questions at
No
your end?
question, thank you.
Okay, Noreen, any questions at your end?
No question.
Okay,
No question.
Mr. Aslam, No questions, okay. And Jefferson, any questions at your end?
Yeah, I have some questions, but not related to this module. It's about the previous one.
Previous learning outcome.
Yeah, I will send it on over the email.
All right, okay, that's fine, no problem.
Yeah.
Okay, no worries. Thanks for joining in today. Then what I'll do is I'll bring this session to an end, and we're going to do the discussion on the assignment brief next week on Monday, because this Monday we missed out on the session because of bank holiday Monday. So next week we'll start off with discussing the assignment brief for the health and social care sector unit. So if you collate all your questions that we need to be able to look at for the next session, Monday and Tuesday, that will be useful, and we could do a bit of a recap when we are discussing the assignment brief as well.
Okay.
Okay, thank you so much for joining. Take care. Bye for now.
Sir. Sorry, can I get?
Yes, go on.
Yeah, the last class I was in the last class. But can I get in my mail?
Sorry, go on.
The last class, like the previous class I was in.
Last class or last two classes you can access from the YouTube channel. If you go on to the YouTube channel, you should be able to get the last two classes. 1 second, I'll show you how to get hold of that. 1 second. So if I take you this particular website that we have, which is, I'll put this on the chat to you as well, just the link. So here, if you go on to the videos section, and in the video section, today's session is being broadcasted live, as you can see, which is here, the live session. But if you want to see the learning outcome 2, so here is learning outcome 2, health and social care sector LO2. And if you want to see learning outcome 1, if you go down slightly, you will see learning outcome 1 as well, which will be health and social care sector LO1. Okay, so all videos that, all lectures are essentially uploaded on this particular channel, and you'll be able to see the lectures from here. Okay, any other questions? Okay, thank you so much for joining then, and I will try and end the session now, and we'll catch up with you next week.
Thank you, sir. Bye.
Take care. Thank you. Bye. Bye for now.
Thank you. Thank you. Bye.
Bye.